Hello once again. Welcome to our YouTube channel. Today we'll be describing the histological organization of the male reproductive system. So welcome to our session today. What will we be looking at today? The various segments that we'll be looking at today will be, first of all, we'll be checking the components of the male reproductive system. So both the internal and external genitalia. And then after that, we'll also look at the structures and the functions of the testes, the glandular part. So what is histological organization, its function. Then we'll be looking at the various components and the functions of the blood-testis barrier. We'll be looking at the process of spermatogenesis. So how does it happen? We'll try to check on the structure and the components of the male genital duct system. We'll try to describe the structure of the prostate and the seminal vesicles, and then wrap up with trying to talk about the histological organization or the cross-sectional anatomy of the penile shaft. So we will start by talking about the parts of the male reproductive system, and we need to see an image for us to be able to talk about that. So the image on our right is showing us the various parts of the male reproductive system. At this point, you can be able to appreciate this is a penis. You can appreciate this is the testis. You can appreciate at this point, you have the prostate gland here, the seminal vesicles, and then you have the bulbourethral glands or the Cowper's glands here. Also, we can appreciate in this penis, at this point we have the glans penis, the anterior most part with the prepuce being there, and then we have the urethra in it. So this is a penile urethra. Then you can appreciate you have a membranous urethra, then you have a prostatic urethra, and then the preprostatic urethra is there. Then we can appreciate from the testis, first of all, you have the scrotum with the various layers. We look at the layers in a few minutes. It has a testis in it. Then you can appreciate the epididymis is here. Then you have the ductus deferens. That's the ductus deferens there. The ductus deferens. Then the ductus deferens joined together with the seminal vesicle to give us the ejaculatory duct. Then the ejaculatory duct joins the urethra. So at this point now, there's a reason why the urethra will be containing both the urinary part and the reproductive part, because it will be carrying the semen and the sperms and also the urine. And then now it goes, the bulbourethral secretions will join in, and then after that, they go out there. So at least we can be able to appreciate the flow there. But another point to appreciate is that we need to talk about, we can appreciate there is some fat that is present, the fat that is present, and also in this scrotum, it will have some thickening. So we need to appreciate the reasons why you have those thickenings. So the flow of sperms on the image on our right will be from the seminiferous tubules to the rete testis, from the rete testis and the ducti efferents to the epididymis, and then from the epididymis, we'll have the seminal vesicles joining the ductus deferens at this point to give us the ejaculatory duct. The ejaculatory duct, ideally, in the prostate joins the urethra, and then the secretions, ideally, will come out using the penile urethra. So that's the flow. That is the flow that we'll have of the sperms from the seminiferous tubules until ejaculation using the penile urethra. So what are the functions of the testis? We start us off by looking at the testis. So the testis, in it has seminiferous tubules, and the testis, it produces about 12 trillion sperm over the span of a person's life, a man's life. So it's quite a number of sperms that are produced. So the function of the testes, it has two major functions. One of them is to produce now the sperms, and then the other one is to produce male androgens. And male androgens majorly will have the most important one being testosterone. So testosterone has various functions that you need to appreciate. One of them being it enables the growth, first of all, the maturation of the reproductive organs, and they can be able to mature during puberty, then enables now the secondary sexual characteristics in male. So depending on the voice, makes the facial hair grow, the beards, develops the heavy muscles, so it enables the masculinization. Then it also enables the strengthening of bonds, and then allows sperm production. So that's the reason why a male boy child who is before puberty can be able to produce sperms, but after puberty, the child can be able to produce sperms. Yeah, so these are histological organization, but we'll look in that in a few minutes. So the two functions, production of androgens, production of sperms. So what you're looking at right now is actually the slide on the testes. We can be able to appreciate that it has a stroma. So what is covering this is actually the stroma. So remember, the stroma at this point will cover the whole of the testis. It will contain some blood vessels and nerves, and also some lymphatics. That's the stroma. So stroma will be divided into two. It will contain a capsule, which at this point it will be thickened to be known as tunica albuginea. So the thickening that we'll be talking about right now is this thickening here. So the thickening at this point will form the tunica albuginea. That's the tunica albuginea, the thickening that we talk about, and actually forms the capsule. And it's thick, dense connective tissue. Then, ideally for this tunica albuginea, it will have an inner part and an outer part. So an inner part will be known as tunica vaginalis. So a point to appreciate is that this tunica albuginea, on the inner part of it, will contain tunica vascularis, and this tunica vascularis will contain blood vessels and nerves. That's the reason it's called tunica vascularis. So tunic for a layer, and then vascular containing blood vessels. So on the inner part of tunica albuginea. And then on the outer part, you can appreciate you'll have tunica vaginalis. You can see tunica vaginalis here. So on the outer part, it's actually a serosa part. So tunica albuginea is surrounded by a serous double membrane known as tunica vaginalis. So tunica vaginalis at this point will be here. So the capsule, that's a capsule, you can be able to appreciate it. That's the tunica albuginea. Then on the outer part, it will have the tunica vaginalis, inner part, tunica vasculosa. Then on the posterior aspect, so on the posterior aspect, we'll have this tunica albuginea undergoing thickening. It will thicken to form the mediastinum. It will thicken to form the mediastinum of the testes. And that mediastinum of the testes is then we'll have the excurrent ducts that will come and form the rete testes. But we'll see that in a few minutes. So here, at this point, we'll have the thickening. This is a mediastinum of the testis. From the posterior aspect, they will thicken to form the rete testes. So this is a mediastinum of the testis here. So, and then this tunica albuginea will send in trabeculi. So this trabeculi will arise from the rete testis, from the mediastinum, and they will divide. As you can appreciate in this slide, the septi coming from the tunica albuginea from the mediastinum will divide this testis into various lobes, into the various lobules. So for example, at this point in this slide, you can appreciate here we have the mediastinum, we have the rete testis here. So these are the various septa And this cell type, for example, you can take like this one now. This one is a testicular lobule. And this testicular lobule will contain about 3 to 4 seminiferous tubules. So we can see there. So a testicular lobule has seminiferous tubules, about 3 to 4 of them, for spermatogenesis. And between the tubules, now we'll have this. We'll have the interstitial cells of Leydig. We'll have the various interstitial cells of Leydig. And then the lumen of these seminiferous tubules will open using the tubuli erecti, the straight tubules, to the mediastinum. It will open here to form the rete testis. And then from the rete testis, you'll have some small efferent ductules known as the ductuli efferents or the excurrent ducts. They will come from the rete testis into the epididymis. So you can appreciate the epididymis with the various parts, the head, you'll have the body, and then the tail of the epididymis. So these are proximal parts, the body, then the tail or the distal part. So that's the structure of the epididymis. So, but before then, you can appreciate that these seminiferous tubules now will be lined by germinal epithelium. So you can appreciate this is a tunica albuginea, tunica vascularis. At this point, you can see tunica vasculosa. Surrounding it, or in it, you'll have the seminiferous tubules. So this is the seminiferous tubules. So for example, now 3 or 4 of them will form now a testicular lobule. So that is a testicular lobule, as you can see there. So from there, this testicular lobule will contain, in each of the seminiferous tubules, it will contain seminiferous epithelium or the germinal epithelium, which is a complex stratified epithelium. So it's complex because it will contain cells of various shapes. It will contain various cells with various functions. So of which the 3 major cell types will have the germinal elements. So talk about the spermatogonia, talk about spermatocytes, that is primary and secondary spermatocytes, talk about spermatids, and even talk about now the mature sperms that are being released through the process of spermiation. Then it will contain Sertoli cells, which are now the supporting cells, and even the myoid cells. And remember, in between it will contain interstitial cells of Leydig. So here you'll have interstitial cells of Leydig, interstitial cells of Leydig around these parts. Yes. So can you be able to talk about or be able to appreciate the various cell types? Yes. So we'll look into that in our next slide. But here we need to appreciate that this is the germinal epithelium, which is complex stratified epithelium. You can appreciate this is now the Leydig cells, and then you can appreciate the various cell types. So here we have the spermatogonia, and then we'll have the primary spermatocytes. We can't be able to appreciate the secondary spermatocytes because it's under the process of meiosis. Then you have the spermatids here. Then most likely now these ones will be our sperms, mature sperms. So we can appreciate the Sertoli cells here, and then we can also be able to talk about the myoid cells. So you can be able to appreciate these are the myoid cells, which have that contractile function. And these actually they are found on the smooth muscles. Okay, so remember, myoid cells have contractile function. They have that contractile function. So in our next slide, we need to appreciate the structure of the seminiferous tubule. So it has 2 compartments. It has a basal compartment. This is a basal compartment, and then it has an adluminal compartment. Most of the cells that are found in the adluminal compartment are the cells that are undergoing the process of spermatogenesis. So starting from primary spermatocytes, secondary spermatocytes, now the spermatids and the sperms will be found on the adluminal compartment. Then on the basal compartment, now we'll have the myoid cells, we'll have the spermatogonia, that is both the spermatogonia A and B, and then we'll also have now the Sertoli cells. So remember, this is the whole of the Sertoli cells. So Sertoli cells, its nuclei will be found on the basal compartment. Then on the its inner part will be found on the luminal compartment. So remember, this is the blood testis barrier now, but we'll talk about it in a few minutes. So what are the functions of the Sertoli cells that we've seen? These Sertoli cells, they have tight junctions. So the tight junctions, you can be able to see them here. So this is a tight junction that you're talking about. So they have tight junctions that provide barrier to chemicals. So they enable the blood testis barrier. They nourish the developing sperm. So they have a nutrition function and even a metabolic function to the sperms. And then secretes luminal fluids, including the androgen binding proteins. Then they phagocytose the defective sperm. So they have that function of phagocytosis. They mediate testosterone and the follicle-stimulating hormone, their effects on spermatogenesis, so they can be able to mediate testosterone and FSH on spermatogenesis. They secrete inhibin, which inhibits follicle-stimulating hormone secretion. So it secretes inhibin. It secretes androgen-binding proteins, but it doesn't secrete testosterone and FSH. Then we'll have now influence of Leydig cells. It influences the Leydig cells via the paracrine secretions, and then ideally it has embryonic secretions of the Mullerian inhibiting substance. So during the development of the male and female reproductive system, so if you have the Sertoli cells, you'll have embryonic secretions of the Mullerian inhibiting substance that ensures the male phenotype is present. So we talk about the blood testis barrier, and in this blood testis barrier, the components will contain the Sertoli cells, the basolateral tight junctions, and then you'll have the blood vessel. So we can look at here. So this is a blood testis barrier. So it can here's a testis here. So we can maybe magnify one of the seminiferous tubules. So what we'll be looking at is a blood testis barrier. So this blood testis barrier, but appreciate these are the Sertoli cells. And in these Sertoli cells, we have various cells undergoing spermatogenesis. So we have spermatogonium, primary spermatocytes, secondary spermatocytes, spermatids, and then undergoing the spermatids are undergoing the process of spermiation. So on this point, we have a myoid cell here, and then you have the various testicular macrophages. So in between these cells will have the tight junctions. So the components of this will be on the luminal side. So you'll have on the luminal side, it will contain now maybe the sperms, but not on the basal part will contain even some blood vessels. So the blood vessels will contain its endothelium and the basement membrane. So the basement membrane, the endothelium of the capillaries, then the basolateral tight junction of the Sertoli cells, and even talk about the Sertoli cells itself as some of the components of the blood testis barrier. So here, you don't want the chemicals to come and destroy the developing. So the tight junctions in between will help a lot. Remember these secretions? These chemical secretions are coming from the blood circulation or even due to trauma. So in between, we talked about the presence of the interstitial cells of Leydig. What will be the ultrastructural features of the interstitial cells of Leydig? This is high yield. So given that they are steroid-producing cells, they'll contain rich, smooth endoplasmic reticulum. So why are they steroid? Because they'll be producing testosterone. And also, they'll contain a lot of mitochondria with tubular cristae that are actually highly folded. They'll contain a lot of lipid droplets, and they'll have a euchromatic nucleus given the fact that they are active, and you want to store the nuclear material. So euchromatic nucleus. So that's about now the stromal bit the stromal bit. So the stromal bit, we talked about it containing the capsule tunicale virginia and the various trabeculae in between. Then for the parenchyma now, parenchyma you talk about the seminiferous tubules of which we discussed, and then you come now to the ducts. So in the ducts, the first one that we'll start with is the epididymis. And in this epididymis, we have it here. So we talked about it having the head of the, you'll have the head of the epididymis, then that is a body, then that is a tail. Then the tail is connected to this. So we talked about, you have the rete testis. Rete testis, ideally it joins the tubules, the epididymis, using the efferent ductules or the escarent ductules. So this epididymis will contain a pseudostratified epithelium with stereocilia. That's its epithelium. In addition to that, it will also contain a muscular component, of which the muscular component will increase proximodistally. So from here, it will increase proximodistally. So why is it increasing? To enable the contractile function. In addition to that, it will also be covered by a serosa. So it's highly coiled and tubular, lying posterior. Remember, there's a posterior part of the testis, so it will be lying posterior to it. So posterior superior aspect of the testis. And then it has a head with efferent ductules, so you can see the head with the efferent ductules. Then it will also contain the body and the tail. Then it has a muscular wall that will increase proximodistally. The cell types will have principal cells, basal cells, halo cells, and some lymphocytes. And at this point now, we can appreciate this is a tunicale virginia. This is a testis, now the seminiferous tubules. These are the epididymis. And in this epididymis, we need to appreciate at the center here, we have actually the stored sperms that are undergoing the process of maturation now. Then this epithelium, the pseudostratified columnar epithelium with stereocilia. And then it will have a muscular component. This is a muscular component here. And then it will also contain now a serosa that will be covering now on the outer bits. So this is what I've been trying to describe. You can appreciate the spermatozoa at the center. You have the stereocilia. So the epithelium will be pseudostratified columnar epithelium with stereocilia. Here we can be able to appreciate this is now the interstitial tissue. The interstitial tissue, some books will refer it to as adventitia. Yes. And then, so the various cell types that we found in between, we'll have the principal cells there. We'll have the basal cells. Of course, the basal cells will be here. The principal cells are the columnar cell-shaped cells, and then we'll have some lymphocytes in them. Yes, so you can appreciate the columnar cells, the principal cells, the basal cells will be there. And then these are the smooth muscles, and then the interstitium will be there. So this is what I've been trying to describe. We can appreciate the tunicale virginia. She's a testis, the epididymis is there. And then you can appreciate higher magnification of it. So this is now the seminiferous tubules. So this epididymis, the testis. So this side, its higher magnification is the image on our right. So tunicale virginia covering the seminiferous tubules. And these are the convoluted seminiferous tubules. These convoluted seminiferous tubules will contain a complex stratified epithelium with the various cell types. And we saw the magnification of it. And then these are now the interstitial cells of lady, the interstitial tissue there. So from epididymis now we'll go to the vas deferens. So this vas deferens of ours will contain various layers. They'll contain a mucosa, they'll contain a lamina propria. So this mucosa will contain epithelium and a lamina propria, and then you'll have a muscular part and then an adventitial part. So this vas deferens, remember, it's coming from the epididymis. So its epithelium will almost be similar to that of epididymis. It's pseudostratified columnar epithelium. So maybe the difference in this is that it won't contain a lot of stereocilia, very little. So actually, from the point that you have the vas difference on the distal aspect, it will contain some of the stereocilia, but as you move, the stereocilia will decrease and even it will be none. So mucosa will contain the epithelium, which is pseudostratified columnar epithelium. Then it will also contain a lamina propria, which has elastic fibers. It will have a muscular part, the muscularis bit, that will have 3 layers of smooth muscles. And then it will be surrounded by adventitia. So this is what we're talking about. So here we have the epididymis. This is a vast difference that you're talking about. So this is a vast difference. So this vast difference changes the epididymis to ideally the seminal vesicles to form the ejaculatory duct. Yes, so this is what we've been trying to describe. It has a mucosa, and that mucosa will contain epithelium, and it will be contain a lamina propria. Then there's a muscular component with 3 parts. You can appreciate this inner bit, the intermediate part, and then the outer part. Then there's the adventitia. And actually, you can appreciate now at this point, it's just left to the cremasteric muscles, the three smooth muscle layers, and even you can appreciate some blood vessels surrounding it. I know this is what we've been trying to describe. So histologically, you should be able to appreciate this. A mucosa, that is a muscular component. So it will have inner longitudinal and outer longitudinal. Then in between, you'll have a circular smooth muscle. Remember, it has 3 layers of muscle. So inner longitudinal, intermediate circular, and then outer longitudinal. And then the adventitia is there. So those are the layers of the vas difference. Then talk about now the male accessory glands. There will be 3 prostate seminal glands, or the seminal vesicles, and then the cowpers. So in the prostate gland, you'll have a stroma. And this stroma, it will contain a capsule enclosing the posterior and the lateral aspects only. So we need to appreciate the structure of the prostate, but we'll see it in our next slide. So it has a stroma, which ideally has a capsule enclosing the posterior and the lateral aspect. Then, of course, it will send in some trabeculae a little bit. The anterior and the apical surfaces are bound by the gland itself. So the anterior will be anterior fibromuscular stroma. So, and then it will have a glandular portion, which is tubular alveolar. So that is important. So which type of gland is prostate gland? It's a tubulo-alveolar gland. Of course, it has various parts. It has an inner mucosa bit. Histologically, it has an inner mucosa bit, an intermediate submucosal, and a peripheral glandular bit now. So the inner bit will contain mucosa. The intermediate submucosa will contain immature glands. Then the peripheral layer will contain all the mature glands. Yes, and then this peripheral bit will also be surrounding the prostatic urethra. And then the ducts of the prostate are lined by simple cuboidal epithelium. So we can appreciate the secretions in between here will aggregate and form the corpus amylaceum. So the secretions of the prostate gland. And the secretions will be containing the citric acid, proteolytic enzymes that prevent coagulation of semen. So that is the importance of now the prostatic glands, because they'll be producing those secretions. So proteolytic enzymes and citric acid that prevent coagulation of semen. So the layers now will be containing now this urethra. Now the region surrounding it will be the peripheral part. Yes, so let's appreciate this. So what is the various zones of the prostate? So remember, histologically, we talked about the prostate gland containing the mucosal bit, submucosal, and peripheral. What about now the zones of the prostatic gland? So the zones will have a transitional zone. So it's a transitional zone. Now it will be covering the prostatic part of the urethra. Then you have the central zone here. So the central zone just adjacent to the ejaculatory duct. The peripheral zone will be lining now the urethra, not now the prostatic. The prostatic is transitional bit. Then you have the fibromuscular stroma. So remember this, the caps will be covering the posterior aspect. The anterior aspect will be entirely containing the fibromuscular stroma. So that is what we need to talk about, the zones of the prostatic gland. And which part is prone to prostatic benign hyperplasia? That is the transitional zone. Then the peripheral zone is prone to cancers. So the carcinomas of the prostate will be covering the peripheral zone. Then the transitional zone will be covering now, has higher chances of having benign prostatic hyperplasia. So we need to appreciate that that is a histological organization of the prostatic gland and even the zones themselves. So you can appreciate you have the bladder here, the bladder, neck, that's the prostate is location now, and then the prostatic urethra, it's in between. This is the membranous part, then that's the penile urethra. So this is what I wanted to show us, the fibromuscular stroma. As a fibromuscular stroma, in between we'll have the tubular alveolar glands, and then we can appreciate the corpora amylacea here, the corpora amylacea. Yeah, so histological zones is the zone that I was talking about. This is now the urethra, the prostatic urethra. We have the mucosal bit, the submucosal part, and then here we have the peripheral zone. And then the fibromuscular part now. The transitional zones will be here. So that is it. We need to appreciate about the histological organization. And actually, you can appreciate the peripheral zone has a lot of glands, which are tubular alveolar glands. Yeah, so before we go to the next slide, maybe you can take a break of about 10 minutes, then we come back and continue with our session. Thank you. Yes, so welcome back once again. We can be able to appreciate that here we are looking at the male accessory seminal vesicles. So in this male accessory seminal vesicles, its histological organization is important. Why is it important? Because of its secretions and how it looks like. So ideally, it has a honeycomb appearance. So this is a honeycomb appearance also of the lumen. The honeycomb appearances of the lumen. And then it has yellowish alkaline fluid, of which now 80% of the seminal fluids contains fructose, fibrinogen, and prostaglandins. These just prostaglandins. So they just enable the function, the support of the sperms during the production. So 80% of the semen will be containing this structure. So fructose, fibrinogen, and prostaglandins. It has, once again, it has a mucosa, which is pseudostratified columnar epithelium. It has a lamina propria, which has loose connective tissue and has elastic fibers. That's the reason why it will be appearing like some fibromuscular. And then it has a muscular bit, the inner circular and the outer longitudinal. And then an outer part will be now the adventitia. So we need to appreciate this is what we'll be looking at now. The lumen is a lumen, honeycomb appearance, the lumen here, with the epithelium, which is stratified columnar epithelium. Then the muscular bit, inner circular, outer longitudinal, and then the adventitia. What about now the corpus glands or the bulbourethral glands? So these bulbourethral glands, also known as the corpus glands, will be homologous in females to the Bartholin's glands in females. So they just produce a pre-ejaculate that cleanses and lubricates the urethra prior to the arrival of the semen. And now his histological organization will be this now. So it will contain tubular alveolar glands lined by simple cuboidal epithelia. So these are the simple cuboidal epithelia. Its histological organization will be almost similar to that of seminal vesicles. divided into lobes and lobules by skeletal and smooth muscles, as you can see here. And then the last bit is now looking at the histological organization of the external genitalia. So here we can be able to appreciate you have the blood vessels, then you have the tunical albuginia. So this is a tunical albuginia. You have two corpora cavernosa, and then corpus spongiosum. These corpus spongiosum contains the urethra. Maybe before then, you need to appreciate this. We can appreciate it has an outer bit, which is a skin. Then it has a deep, it's covered by this tunical albuginia. Tunical albuginia now will be containing this erectile tissue, the corpora cavernosum and the corpus spongiosum. And then before you go to the tunical albuginia, will be containing now some blood vessels. One of them is the deep dorsal vein, as you can see there. And then in the two corpora cavernosa, you have some arteries there, which are now the cavernosal arteries. And then remember, they will contain the erectile tissue will be containing spaces which will now contain blood during erection, as you can see there. So that's the urethra in the corpus spongiosum, and then we have the various layers. So histologically, this is what we'll be able to see. So the skin, the blood vessels. You can also try to appreciate the tunical albuginia now, the two corpora cavernosum, the one corpus spongiosum, and in it we have the urethra. Then this is a dorsal, the deep dorsal vein, you can be able to see it there. Then you have some arteries. Okay, so it has two corpora cavernosa along with an artery of the bulb. So you need to appreciate the one corpora spongiosum here, and the tunical albuginia, and the two corpora cavernosa. What about the scrotum now? It's hypersegmented, highly folded, with no subcutaneous or adipose tissue. So it has no subcutaneous or adipose tissue. Why? You don't want a lot of heat. So this is it. It's highly folded. It's hyperpigmented. And then we can be able to appreciate it's actually, yes, so some of us requested us to go back to this scrotum and talk about it being hypersegmented. So that's the reason why it will be more dark, more pigmented. It will be highly folded. It will be containing no subcutaneous or adipose tissue. Another thing that we need to appreciate regarding this scrotum is that it has various layers. For those layers, here we have the testes. From the testes, maybe you can start from the outside bit. We have the scrotum. It has a muscle known as, okay, you have the skin now, the skin, then a muscle, which is a dartos muscle. Then from the dartos muscle, we'll have the various fascias. And the first fascia that you need to talk about is this fascia that comes from the external oblique. Then you have the fascia here from internal oblique. And then now we'll have that cremasteric muscle, and then we'll have now external spermatic fascia. Then from the external spermatic fascia, we'll have now the spermatic cord itself. So the whole of this, ideally, the whole of this is a spermatic cord, of which it has various layers. So the various layers, you start from the skin, then you go to the dartos muscle, then you go to external, before you go to the external cremasteric fascia, you'll have, okay, in between the cremasteric fascia, you'll have external spermatic fascia, cremasteric fascia, and then you'll have the internal spermatic fascia. From the internal spermatic fascia, you'll have now the the contents themselves. Now talk about the ileoinguinal, now talk about the vas deferens, the pampiniform plexus, the testicular arteries, all of them will be here. And then remember, this is a deep inguinal ring, this is a superficial inguinal ring. So it's better we know how these muscles of the external abdominal wall, ideally, they extend and give us the structure that form this. So those are the structures that we need to talk about. So skin, the datos fascia, talk about external somatic fascia, cremasteric fascia, internal somatic fascia, the cremasteric muscle itself, and then how now you'll have the testis being covered, give us the tumical Virginia, then we'll have the vas deferens and other structures in the cord itself. So it's better we appreciate that. Then the image now on our right shows us a higher magnification of the scrotum. So at this point, we can appreciate this stratified squamous and keratinized epithelium. So stratified squamous keratinized epithelium. Why? Because you can see this keratin here. This is keratin. And then this is a stratification that is present. So now adipose tissue. And then now we start with some component of a muscle here, the dartos muscle. Remember, the dartos muscles contracts, and it's the one that enables actually the folding that are present on the skin. It contracts to elevate or to bring now the scrotum and its contents closer to the body during low temperatures, and during high temperatures, the scrotum the dartos muscle relaxes. And that's the reason why we need, because remember, we need the testes and the epididymis to be at a lower temperature, maybe about 2 to 3 degrees below the normal 37. So around 34, 35, so that to enable the process of spermatogenesis. So that is the reason why we have this. Yes. So that's now the whole cross-section about the scrotum. So stratified squamous and keratinized epithelium, you can be able to appreciate there. The stratification, the dartos fascia, the dartos muscle is there. Yes, and it's actually a smooth muscle. Then this slide is just showing us the process of spermatogenesis. And in this process of spermatogenesis, why do you need to know about it? Of course, it's tested in exams. Of course, you also need to appreciate how the process itself happens. So maybe from here, you have the spermatogonia. Spermatogonia can be either B type A or type B. So of which some of them will remain, some of them will undergo the process of mitosis now to become primary spermatocytes, secondary spermatocytes, spermatids, and then mature sperms. So here, at this point, we need to appreciate this is a process of now the process of modification, the spermatogenesis here. So the spermatids, can appreciate the chromosomal vesicle comes in, it's being formed. You can appreciate the flagellum comes in the tail, the mitochondrial, you can see them there. The lytic enzymes will join their chromosomal vesicles, the proteolytic enzymes. We talk about acrosin and the rest. Then excess cytoplasm is removed. So some of the modifications, and then even the midpiece now containing the mitochondria. Yeah, so that's now, by the end of it all, you'll be containing now the head, the neck, the midpiece, the tail. So those are the modifications that you'll have there. And then now, so for example, in here, you'll have the spermatogonia. From the spermatogonia, here, we'll have primary spermatocytes, secondary spermatocytes, then you have the spermatids, then you have the mature sperms. So that is spermatogenesis. Okay, then we'll have here the process of meiosis is happening. First, this is mitosis, sorry, A is mitosis. primary spermatocytes, this first meiosis, giving us secondary. Then at this process now we'll have, these are the spermatids that we have. Then these are now the process of modification. Then at this point now here we have the secondary meiosis. So secondary meiosis is here. So mitosis, first meiotic division, second meiotic division. At this point now we have the modification that is happening. So that is the process of spermatogenesis. So maybe to answer this exclusively, spermatogonium undergoes mitosis. So you can see almost this cell and this cell just looks the same, that is mitosis. Then first meiotic division is happening, give us primary spermatocytes. Second meiotic division is happening to give us secondary meiotic division is happening to give us the spermatids. The spermatids undergoes the process of modification to give us mature sperms. Yes, so kindly take note of that. Spermatogonium, primary, secondary spermatids. Here you have the secondary spermatids, primary spermatocytes. Sorry, primary spermatocytes, secondary spermatocytes, then spermatids. Yeah, so that is it. Mitosis, first meiotic division, second meiotic division. Then you wrap it up that way. So that is it regarding now spermatogenesis and everything regarding it. So you can have this in your exam, and then you can be asked in an exam setting. Yeah, so kindly take note of that. So I guess I've come to the end of it all. Maybe to wrap it up by just wishing you all the best in your future endeavors as you practice as a medical practitioner, in your exams as a medical student, and even in your future endeavors in wherever you go, and tell you that, yes, submit to him always, and he'll bless you, he'll be there for you. So with that, I wish you all the best in your endeavors. See you in our next video on the female reproductive system. Thank you.